Good morning, it's Dr. Garrett. Today I wanted to talk to you a little bit about migraines. Now, as we know, women tend to get migraines more often than men do, and they can be absolutely debilitating. They can be brought on by a variety of different ways. Not sleeping right, not eating right, not drinking enough water, the weather, stress, hormones. There are just so many facets to this that it's hard to even describe them all. But what we do know is that they are absolutely awful. However, there are some things that we can do nutritionally that can help stave off or prevent these from occurring and maybe make it a little bit easier to deal with. So let's talk about these nutritional things that we need. Magnesium. Magnesium is such a wonderful supplement for us to be taking and making sure that we're getting out of our diet every day. There have been numerous studies that have shown that with patients who have low magnesium, the progression from no migraines to migraines is very quick. So even if you've never had migraines before and all of a sudden your magnesium's low, you can start developing these. They've also shown that there is quite a bit of pathogenesis or creation when people are even teetering right there on the edge of being low with magnesium. And as we know, magnesium is so good for the rest of our body. It's good for our brain. It's good for our heart. It's good for our digestion. It helps relax things. So take some magnesium. Now there's also a variety of different B vitamins that can also help us so that we're not getting migraines as often. The first one is riboflavin. This is B2. Niacinamide or niacin, which is B3. Folate, which is a B vitamin, and B12. These B vitamins, and if you can get them in a good B complex, can help prevent migraines. They also do quite a bit for energy, nerve pain, musculoskeletal pain, memory, brain fog, all of that. So a good B complex. Now, there are a couple of antioxidants that we can take that can also help with migraines. This is going to be things like alpha lipoic acid that we can get from tofu, quinoa, black walnuts. We can also use vitamin C to help boost our body and prevent migraines. Now, there are a couple things like CoQ10 that can help reduce the frequency of migraines. If you take a statin medication for cholesterol, studies have shown that these statins tend to strip our bodies of CoQ10. And we need CoQ10 for a lot of things, for our heart, for our brains. But studies have shown that if you're low on CoQ10, you're more likely to have migraines. Now, there's a couple other things like L-tryptophan, which is very good to help with migraines, but one of the craziest ones is melatonin. Studies have also shown that patients who are low in melatonin tend to have migraines of a longer duration and more frequent. So one of the things about melatonin, though, is I don't like patients to be taking this on a regular basis. Melatonin is made naturally within our bodies, but we have to have B12 in order to have that precursor to synthesize melatonin. When it gets dark outside, your body begins releasing the melatonin due to its nice little internal clock, and that's what helps us to sleep. So if you are low on melatonin, you can take a melatonin supplement, but usually I tell you just to make sure your B12 levels are normal, and usually that'll help kind of settle things out. But again, if you are getting these from your food sources, you're going to be noticing that you are going to get better assimilation or digestion and working of these vitamins than you would if you're taking a supplement. So I always recommend that you get it from your food sources. Now, if it's one of those things where you're getting migraines all the time, there are a couple things that we can do just to kind of help. That's Botox in the back of the neck. We're usually using about 8 units, and that'll help relax out those muscles so that you're not getting that pain. Typically, this is when you're getting the pain behind one eye. We can also do what we call an SPG block, where we're using some lidocaine and we're putting it on that sphenopalatine ganglion in the back of the nose, and that numbs it up so that it helps that migraine go away. Now, we do have some IVs that we can use, like a Myers cocktail, or even one of our immunity blends that has alpha lipoic acid in it and vitamin C, as that will help reduce those migraines. If you have any questions or you need to schedule to talk about migraines or get on one of our treatment plans to help with migraines, give us a call. The number here, 812-290-2128, and I hope you have a great day.